We're going to get in more now with concussion treatment with this non-athlete population. Concussion represents a metabolic versus a structural injury, which is the main confusion with a lot of people and why a lot of people don't understand it. A lot of people think that there's bleeding, swelling, bruising, more of a structural injury. I think it's really important sometimes to just break it down as more an energy crisis in the brain, explain it in a way that people can understand. I often give this example of kind of a gas tank. Your brain's operating more on empty than it is on full, and it's working less efficiently. We know the primary elements of the energy crisis following a concussion includes neuronal depolarization, a release of excitatory neurotransmitters, ionic shifts, changes in glucose metabolism, altered cerebral blood flow, and impaired axonal function. Now, because it's not a structural injury, I also make sure that patients understand no imaging or special tests are going to definitively show concussion. Sometimes they come to the office with the expectation that we're going to do a CT scan and that's going to tell them that there is a concussion or not. There are signs of concussion as well as symptoms of concussion. We often group the symptoms into clusters, including physical, emotional, cognitive, and sleep. And when you see non-athletic populations presenting weeks or months after the injury, sometimes they come acutely, but a lot of times it's later. It's important to consider the timeline of symptoms in terms of when they presented, how often they're happening, to ensure they are following patterns we would typically see for concussion versus maybe another medical condition as well.